anterior pelvic tilt. This bone, your sacrum, tilts forward. It creates hyperextension in the lower back, and it irritates the posterior joints. It irritates the discs. It irritates the hips, and it causes pain. In this video, I'm going to show you how to fix your anterior pelvic tilt while you sleep. Let's get to it. Let's get right to it. Anterior pelvic tilt is a biomechanical problem, postural problem, where you have excessive lordosis, so hyperlordosis in your lower back, and your sacrum tilts back. When you're sleeping, if you have this, you know you wake up with a biomechanical hangover the next morning. You're sore, you're achy, you're stiff, and it flares things up. So why not let's use your sleeping time to make sure you're most efficient in trying to fix this and taking pressure off the system. Oftentimes patients present with anterior pelvic tilt and they have other issues. They have degenerative disc disease, they have an anterolisthesis where the bone shifts forward, they have other postural issues. So this is a really good baseline sleep position to help with all those problems. Anytime we're trying to fix posture, we want to do the mirror image opposite of what is happening. So what we want to do is we want to flatten this lumbar spine out by focusing on this triangular shaped bone right here called your sacrum. So we can visualize that by tucking that in. So we want to tuck this in to flatten this out. Now, a tip to help with this is having a pillow here. Let me demonstrate so I can show you exactly what I mean. We've all heard you need a firm mattress. Well, this is no truer for if you have anterior pelvic tilt or you're excessively flexed forward. Let's push our back and curl our tail in, so to speak. Get a nice pillow to support our neck, a fairly big pillow to help keep our legs slightly elevated. This will allow us to engage a posterior pelvic tilt by tucking in our sacrum and relaxing into it. You can see if you don't have a pillow, it creates way more anterior pelvic tilt. So you want something that's very simply supporting your legs to help you engage and really visualize taking your sacrum and pulling it up and then letting the bed and gravity do its work. You can cross your legs if you want, one side or the other, but really focus on taking your sacrum, that triangular shaped bone at the bottom of your spine, and tucking it in. Like I said, opposite, equal and opposite would be a posterior pelvic tilt. And stay in this position. Now you will flip from side to side. We get that, and I understand that. The key here is making sure, again, to make this a little bit less stressful on that lower back, take your legs and pull them up to not quite 90 degrees, but almost 90 degrees. This is where I need a bit thicker pillow to make sure we're supporting our neck. We don't want to try to fix one area and neglect another and cause another issue. So you really want to make sure that you're not in extension because that's just making it worse. We want to pull up slightly and keep our head up. We don't want to come down to a fetal position because that's going to give us a neck issue. I have lots of videos on how to sleep with neck problems. You might want to check those out, but make sure that you're not tucked in like this. If you know you have anterior pelvic tilt, this is an acceptable way to sleep when on your side. So there are two positions you can use on your back and on your side, but make sure you're doing the subtle movements that we talked about here. I want to show you a quick stretch and a quick exercise that you should do first thing in the morning as soon as you get out of bed to help with that anterior pelvic tilt as well. As promised, here's the first stretch. We probably know what it's done, but there's a few subtle things you want to do to make sure it's effective. We want to stretch our psoas muscles to help with our anterior pelvic tilt. One thing you want to make sure you're doing is when you're on your knee, when you activate and you pull forward here, you really want to make sure you're firing the opposite glute. So let me show you here. Let's go this way. I want to reach forward. You're going to keep your body upright. I don't know if you can see my head here or not. I may be cutting myself off, but that's okay. As we lean forward, we don't want to bend forward. The other thing we want to do is we want to activate, so you should be able to press and really feel that engage. Your glutes need to turn on for this, and you're going to really feel that down the front of your thigh and into where that psoas muscle would be. Hold this for 15 to 30 seconds and do this both sides twice. You can do it multiple times a day, but I think when you first wake up after you start moving around, it's quite effective. The next thing we're going to do are glute bridges, just with a subtle twist. We're going to tuck our pelvis in and then up. So what we don't want to do is we don't want to keep neutral. We want to do a posterior pelvic tilt and hold. Hold this for 30 seconds. And if you want to turn it into an exercise, you can hold your pelvis in posterior pelvic tilt and then do reps for your glute bridges. Really squeeze your glutes. The mind muscle link here to fire these glutes. Hold an anterior pelvic tilt. Do not let your pelvis rotate back or neutral. You want to pull it into that posterior pelvic tilt that we talked about. That stretch, that exercise, and that sleeping position will have you well on your way to not only help minimize the pain associated with your anterior pelvic tilt and posture position, but also changing the posture while you sleep. I hope you like this video. If you like videos like this, maybe consider subscribing so you can be informed when I upload a new video. Let me know in the comments, which did you like the best? Have you seen this? Are there any other stretches or exercises that would be benefit to our viewers? Put it down in the comments. I appreciate those comments and I appreciate you tuning in. I can't wait to see my next video. Until then, stay well.